I'm a glaucoma specialist. That means I take care of patients with glaucoma, uh, both seeing them in the clinic, prescribing medications, and doing surgery. I like most about glaucoma that the patient interaction really is very important. The patients are going to have glaucoma for the rest of their life, and it's very important that they understand the disease because by understanding it, they're going to be able to treat it more effectively. I actually went to medical school in West Virginia, where I'm from originally. I did my residency at Baylor College of Medicine in Houston, my fellowship at Wills Eye Hospital in Philadelphia. Through my career as an ophthalmologist and as a glaucoma specialist, I joined the faculty at Baylor, and I was there for 25 years. Grew that department both from taking care of patients as well as research and teaching residents and fellows. By taking care of patients, it's very important. You can take care of a single patient and have a great outcome, but by educating others, you can spread that knowledge and spread that capability over many states across the country where my residents and fellows now take care of their patients. Glaucoma is a disease that historically people think of as just high eye pressure, but there's much more to it than that. The eye actually receives light. It then sends that information back to your brain. You actually see with your brain. That information is carried through a bundle of living wires called the optic nerve. And for those individual living wires to make it out of the back of the eye, to make it to the brain, there's an area of the back wall of the eye that has holes in it. And that part of the wall with holes is weaker than the rest of the wall. And when the eye pressure goes up, that weak spot bulges like a weak spot would on a ball or a tire. And when that bulge occurs, those living wires that used to go straight through the hole and work well suddenly get kinked. And when they get kinked, eventually they die, and the information they carry back to the brain never gets there, and blind spots show up in your peripheral vision. That damage to your vision is really what we call glaucoma. Typically, it happens very slowly, and it happens in the peripheral vision, so many patients don't know that it's there. That's why it's so important that you be checked, that we do all the tests where we measure the living wires, we measure the peripheral vision, we measure the eye pressure, so that we can know exactly how glaucoma is affecting you.